Hi everyone, so today we're going to talk about the triangular fibrocartilage complex and what you might see if this is an injury. So a brief overview of what we will discuss today includes what the condition is, some HOPS notes, which includes the history, observation, palpation, special test, types of imaging, and what to do and care for TFCC injuries. So what is TFCC? Well, triangular fibrocartilage complex is a structure in the wrist that provides support of the carpal bones. The TFCC oversees maintaining the radius and ulna steady while the hand grasps an object or rotates the forearm. The TFCC is composed of the articular disc, the dorsal and palmar distal radial-ulnar ligaments, the ulnar lunate, and the ulnotriquetral ligaments, the subsheath surrounding the extensor carpi ulnaris tendon, the meniscus homologue that attaches to the fibrocartilage to the triquetrum. So how do TFCC injuries happen? Well, there are two types of TFCC injuries. Type 1 is caused by natural wear due to aging. The most common types of wears are this type, and they are not commonly seen in younger people. Some underlying conditions can also cause TFCC injuries, such as gout or rheumatoid arthritis. The second type is caused by injury, and these tears occur from falling on the wrist or hand, twisting the wrist at an odd angle, fractures at the end of the radius, and extended use of the wrist forearm can also cause these injuries. Some common sports that you will typically see these kinds of injuries include high impact sports that use repetitive use of the hands, such as gymnastics, ice hockey, tennis, baseball, boxing, golf, pole vaulting, water skiing, and soccer, especially in goalkeepers. So, one of the most common symptoms of TFCC is pain on the outside of the wrist when touched or moved. Other signs and symptoms include clicking, popping while turning the forearm or moving the wrist side to side, pain, weakness, limited motion, swelling, the reduced ability to grasp objects, and while you notice these signs and symptoms, the patient will also be very tender in their wrist. So how can we diagnose TFCC? Well, to start, we need to get a good medical background. So when you take a patient's history, you got to make sure it is as detailed and informative that will help you diagnose what may be the suspected TFCC injury. So some key factors of history questions include the onset of symptoms, the injury mechanism, characteristics of pain, factors that aggravate the injury, factors that relieve the injury, and if any, functional limitations. Some key questions that you can possibly ask include: when did the pain start? Did it happen after an injury? Has it happened before? Have you had any past injuries or surgeries? Have you taken any medications? What makes it better? What makes it worse? Are there any changes in your daily living activities? Can you describe the pain? Was there any swelling? Does your wrist make any sounds like popping or clicking? Can you point where you feel most of the pain? Did you fall and land on your outstretched hand? Do you participate in any extracurricular activities? What caused the pain to start? So when you're looking for a TFCC injury, when you elevate, some observable characteristics basically include the swelling around the wrist or a recurrent ganglion cyst caused by the TFCC. And while an acute diagnosis, swelling may not be visible. As you can see in the pictures, the fingers are pointing on the ulnar side of the wrist where the TFCC injuries occur, and around there is where you see some swelling or some ganglion cyst. As this picture that just showed up gives you a visual of what the ganglion cyst could possibly look like. And in this last picture, you can see in the red circle where there is some slight swelling, not a lot, to where you can visibly see. So when palpating, you have to be sure to palpate bilaterally. So you start with the unaffected side first to get a glimpse of what the patient's normal range or symptoms are compared to the affected side. You work your way down from the elbow to the wrist. So you go from the radial side and move to the ulnar side, and then you palpate over the ulna. When you palpate over the ulna, it will possibly be tender. The UCL may also be tender. You also move the wrist into ulnar deviation that can also elicit the pain along the TFCC. So motion may be limited in wrist extension. So ulnar deviation is when you move the wrist towards the pinky, like move it down to the side. And here are some pictures of some palpations and how the ulnar deviation is at the top picture. So some special tests to rule in TFCC include the McMurray's test, where the examiner pushes the lunate and triquetrum up and down in the wrist, which is ulnarly deviated, and with the TFCC tear, the patient experiences discomfort and a snapping noise. The load test is where the examiner holds the patient's hand in the handshake position and ulnarly deviates the wrist, squeezing the TFCC and rotating it through the arc. If the test is positive, it produces crepitus, clicking, and pain. The ulnar carpal stress test is where the examiner grasps the patient's hand across the carpals while the opposite hand supports the posterior elbow. The wrist is moved into ulnar deviation and overpressure is applied. Axial load is applied to the wrist during pronation and supination. And the TFCC compression test, the examiner grasps the patient's hand across the carpals while the opposite hand grasps proximal to the patient's wrist. The patient's wrist is passively moved into maximal ulnar deviation. A positive sign is marked by pain. As you can see here, you see the ulnar carpal stress test and the compression test. So, according to Starkey, if a TFCC injury is suspected, referral is warranted by a physician for further evaluation. So, for further examination, imaging may be required to help confirm the suspected injury, and some imaging includes MRAs, or X-rays. So, in the top picture, you see the MRI, and next to it, the MRA. The bottom left shows a negative ulnar variance, and the right picture shows a positive ulnar variance. So how can we manage TFCC injuries? Well, the management of the injury is dependent on the severity of the injury. So small acute tears can be treated conservatively with short arm casts of Buller's wrist splints. Other forms of treatments include icing the joint for 10 minutes at a time, pressing the area with an ACE bandage, physical therapy and stretching the wrist to improve range of motion, and if the physician offers, prescribe pain medication such as NSAIDs, and injections may also be an option to temporarily reduce pain and inflammation. And here you see some splints or casts that we would possibly use for TFCC injuries, and this last picture shows an injection. So, what is the next step? Well, if conservative acute care does not alleviate condition from pain and its symptoms, surgical management is indicated. So, surgery is required to repair a complete tear of the TFCC or to treat TFCC pathology linked with wrist trauma. This is possible with open surgery, as you see in the picture, and although arthroscopy is now the preferred approach, arthroscopic surgery is performed to repair torn ligaments and remove the cartilage fragments from the meniscus, which can limit wrist movement. This operation is known as arthroscopic debridement. With more severe TFCC ruptures, the ligaments can be reattached using wires and screws. So open surgery is preferred for the TFCC injuries that are associated with radio-ulnar ligament rips, joint instability, and or the presence of bone fractures that require fixation. By delayed intervention from the moment of injury, the retracted damaged ligaments may be replaced by a graft. So you can see in the pictures, we have a open surgery, an arthroscopic repair, and kind of how the arthroscopic repaired in the middle picture. So it is important that we follow up on patients no matter what kind of treatment recovery process they are following. So some social determinants of health, you have to think about the recovery time of the TFC injuries. That can vary depending on the severity and treatment options. TFCC tears that do not require surgery may take up to 12 weeks to heal. And if the patient undergoes surgery to correct the injury, the doctor will more than likely recommend a brace to keep the wrist immobilized for up to 6 weeks. And then a tear may take up to 3 months to recover following surgery. So maintaining wrist mobility and starting physical therapy as soon as the injury has healed, which is around 6 to 8 weeks post-op, it is essential to prevent joint stiffness. So with the long recovery times from TFCC tears, injuries, it is best to keep aware of the patient's symptoms, how their daily living has been altered, and making sure they have the right support group through the recovery process. It is vital that these patients may be monitored because they may become withdrawn if they no longer follow a continuous routine due to the injury. So an altered life changes may have a greater impact mentally, emotionally, and sometimes physically. And here are the resources used to find all of this information. Thank you.